I'm really curious, how did your product evolve through the coronavirus pandemic?
I could take that one.
Okay, go for it,
Yeah,
Preethi.
this is Preethi, everyone. So COVID was obviously something none of us expected. But the nice thing about COVID, if there's anything, is that it really propelled us to stretch the edges of our technology and our design brains, but also all of the work that happens in offices and on the ground. And an example of that is really when we were able to use a tool within our product we call Treat Me Now. It's kind of beloved, where patients could take this brief survey through this tool and share pertinent symptoms, share information as well as their symptoms. They were able to then figure out their risk factors, and as a result, that was routed to a provider for review. So, for example, that provider would then get in touch through the app to that patient with a care plan that's based on their symptoms or their specific needs. So even though internally it required us to create dozens of templates related to the most frequently asked questions, we were also then able to open up our virtual queues for in-office providers to hop into these queues, assess symptoms, and really provide a lot more comfort to our patients, as well as escalate these medical concerns if necessary. We also have a method to create an automated check-in 14 days later. So it's not just a one and done approach to healthcare. These providers who are maybe having video chats with our patients could then set an automated check-in and make sure that patient was feeling better in 14 days or escalate the situation if necessary.
That's great. Yeah, no, it made it a lot easier and clearer to get the healthcare and that the care that people need right now. Especially, I remember that I got an email from One Medical that said that you had pop-up tents and testing, like you were the first company or I guess healthcare organization that offered pop-up testing, and at least in San Francisco, from what I remember, which is amazing. And it's been a really anxious time for us. It's been really like high anxiety. Now, what do you think is the biggest anxiety relief of your app during a time like COVID?
Yeah, I think one, COVID is so unpredictable. So something even as simple as being able to book your COVID testing appointment rather than not knowing how long the wait is going to be, not knowing if you're going to have to drive up somewhere that's really far away from where you live. Having those resources accessible and having a plan even related to booking an appointment at its like most simple state, I think is a form of reducing anxiety. I think another is the fact that we try to make it feel like One Medical has your back, right? So the fact that all of your all of your health records as a member are within the same system, and whether you got tested 2 months ago or 2 days ago, all of the providers are able to see that entire interaction, is something that we think provides comfort as well.
That's great. That's fantastic. And it's comforting for myself on both like the patient side, also like designer approved, but thank you, Preethi. Okay. And I do have a question. So this pandemic has caused like all kinds of policy changes, new information, and there's a lot that has been going on over the past 10 months or so. It's been wild, and I send my love to everybody here, so thank you. Hope you're all doing well. But I have a question for Niki, Niki works on the provider side. Niki, how does One Medical adapt to changing requirements or policies during the pandemic?
Sure. It's something that One Medical is used to in the realm of abiding by government policies in this healthcare landscape that we live in. And so new policies that have come through during this time have been something that we've been looking out for and have processes in place to adapt to. one example is, or historical studies have shown that viruses impact people with different demographic backgrounds differently. And so the same goes with the coronavirus. And there was a new policy in place starting this past summer that was exactly about that. How might we report coronavirus test results and patient demographics at a macro level to the Department of Health, so that not only that we can observe how the coronavirus is impacting our population health, but the government can also identify that as well.